got an update on an exclusive CBS News KFF Health News investigation into a dental device that many patients said damaged their mouths. It's called the Anterior Growth Guidance Appliance, or AGGA, and the device's inventor, a dentist named Dr. Stephen Galella, claimed it could cure TMJ jaw disorder and sleep apnea. That's a biggie. The AGGA and Dr. Galella are now under criminal investigation. And this morning we are learning that the dental lab that made the device was never inspected by the FDA, at least not before our investigation. Senior consumer investigative correspondent Anna Werner is here with more on this. Anna, good morning.
Yeah, good morning, Tony. It was our investigation that brought the AGGA device to the FDA's attention last March. Public documents obtained by CBS News and KFF Health News show several months later, the agency showed up for its first ever inspection at the device's manufacturer, John's Dental Laboratories, an 85-year-old company in Indiana.
These are some of the patients who told us a dental device described by its inventor as a cure for common conditions instead wrecked their mouths.
I noticed my teeth were starting to get loose.
I can't bite into absolutely anything.
My front 6 teeth also became extremely flared outwards. All 6 of them, yes, they were doing this.
The AGGA was promoted as a device that could expand the upper jaw without surgery to help treat TMJ problems and sleep apnea.
It's the best kept secret in orthodontics.
Its inventor, Tennessee dentist Dr. Steve Galella, seen here in Australia training dentists to use the AGGA in 2017.
You can cure people of things they never thought they could be cured of.
His device was manufactured here at John's Dental Laboratories in Terre Haute, Indiana. Medical device companies are supposed to register their products with the FDA in most circumstances. But documents obtained by CBS News and KFF Health News reveal that the FDA became aware of the AGGA through our investigation. John's Dental never told the FDA it was making it, and the manufacturer had never been inspected. A few months after our report, an FDA inspector showed up unannounced at the company's door. And what did he find? He wrote that customer complaints to John's Dental about the AGGA were not adequately investigated. In fact, of 4 complaints the manufacturer received after our story ran, alleging the AGGA device had caused patient harm, 0 were investigated, the inspector wrote. Each complaint was closed on the same day it was received. Attorney Jason Brook, who specializes in medical device regulation, says of that finding,
usually it takes weeks to perform a thorough investigation, and to do that in less than 24 hours is almost impossible.
Device companies are also supposed to alert the FDA if they get complaints that their products may have seriously hurt patients. But the FDA inspection report said John's Dental had never told the agency about any complaints about any of its products.
That's a red flag for me.
Former FDA manager Madrice Kennard runs a company that analyzes FDA data.
And what does that say to you?
Well, it says to me that the company isn't doing their due diligence, or if they are, they aren't communicating that to the FDA.
The FDA's response? It told us it did not believe it was required to inspect John's Dental prior to 2018 because it was under the impression the company was operating as a dental lab, which does not make its own devices as opposed to a manufacturer.
There hasn't been much attention to dental devices in the past, and that hopefully that's going to change in the future.
Both John's Dental and Dr. Galella have declined to comment. They've each settled at least 20 lawsuits filed by AGGA patients, but have not publicly admitted any liability. An attorney for Galella told us last year that the AGGA is safe and can achieve beneficial results when properly used. Both the FDA and the Department of Justice have opened investigations into the device after our stories.
Wow, there's a lot in there. So John's has not responded to our request for comment, but have they responded to the FDA?
Yes. So John's Dental responded to the FDA. It sent letters to the FDA saying that it will correct the agency's concerns to ensure patient safety. Company executives, by the way, testified that they started making the device in 2012, producing some 2,000 to 4,000 AGGAs per year. Man, so a lot of them out there.
It's so personal, too. Like, tooth pain is the worst. And then the amount of money that it's going to take to try and fix what's already been broken.
Not just the pain, but how they look.
Yeah, how they look.
Aesthetically.
You can't hide that.
It's embarrassing to a lot of people. And a lot of these patients still have surgeries ahead of them. They still have to spend tens of thousands of dollars. By the way, not covered by any insurance.
That's rough.
All right. Anna Werner, thank you.